I usually would not have so many audience in the US. So actually that's a really positive thing, even it's raining. I know that 1/5 of Australians complain about the conflict between work and family. So I really appreciate that you actually are here right now. Before I start, I'd like to acknowledge my past funding and past and current funding sources. And on the left-hand side of the slides are the funds, the grants I received in the United States. And I also appreciate some funding from the division, thank you, and some funding from the Center for Asian Business and also the IGSB. And of course, without having those financial supports, I probably would not be able to share some experience with you today. But the most important, and a lot of people I could not include here, would be the construction workers, agricultural workers, the youth, migrant workers that I have been working with over the past 25 years. And they actually keep me moving on this line of research. I'd like to start to talk about the sustainability. This is a hot topic, particularly in the business setting. So we talk about the green business. We talk about sustainable business. So let me start from the sustainable bridge. This is a Golden Gate Bridge. It was built between 1933 to 1937. And during that time, when the bridge was built, and they estimate that given any 1 million project, if one fatality was acceptable. So Golden Gate Bridge was built based upon 35 millions. And there were 11 fatalities. So at the end, they conclude that it's a successful project. It's a successful project based upon the dollar terms because it's only 11 people. Now, this is the second largest, probably I would say, is one of the largest construction projects in the United States. The project was built in Las Vegas around 2008, and I was involved as a third party for some fatalities. And there are 8 fatalities within 18 months. Okay, 8 fatalities. And let me give you an idea about the size of a project. At any given time, there are about 5,000 workers. The project was run 24 hours. If you're going to leave the job site after the shift, it will take you 30 minutes to leave just past the first intersection because everyone is waiting in a line to drive away. I include the information, so if you'd like to know about the whole technical reports that we have put in, be happy to take a look at this information. This is on the left-hand side actually was the building still under the constructions. Right now, this is the completions. This is the loveliest, the prettiest buildings in Las Vegas right now. It's 2 major buildings. Again, it's a very successful project. It's sustainable. Lovely buildings. And 8 people within 18 months was killed. Now we talk about another one, is sustainable communication. How many of you actually use the cell phones? Pretty much. Actually, I don't. But pretty much if you look at the past 10 years, all the communication companies rush into building the tower, mobile towers, because customers complain the message dropped, the phone dropped. Between 2003 to 2011, there are close to about 100 people killed just trying to fix or build the tower. I'm only talking about United States. Those workers who work on the top, 100 people. Only 9 years. So I put it into the perspective when I started in 1933, Golden Gate Bridge. That's 11 fatalities. Then we moved to 8 fatalities within 18 months. Now we talk about 100 fatalities within 9 years. So they're all sustainable. It's visible. And we all applaud. We all enjoy the outcomes. So today I actually want to talk about a little bit related to human resource sustainability. It's a sustainable human issue. And that is the topics I'd like to share with you about healthy workplace. According to Jim Quick, a very good friend of mine, and he defined healthy workplace is where people use their talents and gifts to achieve high performance, high satisfaction, and well-being. And the key actually is where? It's the place. It's the place that provide, encourage, motivate people to maximize their potential, use their talents to achieve the highest performance, well-being, and satisfaction. So if we think about the key word is where, then it's good for us to think about what are the driving forces to create a healthy workplace. I list a couple things here. Actually, that's what I'm going to talk about. Today I'm going to cover the legal issue, financial decision-making, design issues, as well as the organization issues. Based upon the different kind of projects I've been doing over the past years. The easiest way to think about these driving forces is to translate that driving forces into this diagram. Essentially, there are certain drivers, and those drivers will affect the proximal drivers. Okay? And let me actually jump here for the moment. This is actually what people do, or a group of people do. And from the psychological principle, actually was proposed by Lewin in the 1930s. There are 3 main determinants that drive people's behaviors. Whether we can do something is, do we know the fact? The second one is, do we know how to do it? Knowing the fact doesn't translate directly to know how to do it. A lot of the time, I think we all have experienced that we can do it, but we don't necessarily know the intricacy. The third one is the willing to do it. Okay? These are 3 proximal drivers. 3 proximal drivers will affect how we decided to do it. But if we do something, it doesn't mean we're going to show the outcomes. Behaviors, or actually do something, doesn't really show the one-to-one outcomes. What do I mean that? The best example would be a salesperson who sells jewels, right? If this person has the excellent sales performance, sales skills, and you put this person, say, into Alice Springs, you probably would not anticipate to see this person will have a lot of performance in terms of the output compared to you put someone in Adelaide. This is just give an example that there are some external factors would affect the relationship between the actually do something and the results. So this is probably the framework I'm going to use throughout today's presentation. So I'm going to talk about how some digital drivers could affect this portion. Then I'm also going to talk about how this relationship could be changed, depends on some external factors. Let me start from the legal issues. Essentially, legal system provide a safety net. That I will always consider that would be our last defense, so to speak. It provides the basic requirements. So Robbins, the law Robbins in 1972 revisits the laws specifically about occupational safety and health in UK. And that spirit essentially shaped how the Occupational Health, Safety and Welfare Act in South Australia. Not only just South Australia, actually pretty much shaped the safety and health concept in Australia, pretty much for every act. So ideally, we might say, well, geez, we have such a wonderful acts. We can enforce them. We should be able to improve or minimize some potential fatalities. But not really that easy or simple, straightforward. I'm going to use these particular things to demonstrate my point that law could provide some basic protection, but it's not a panacea. Okay? I'm using this example right now. Most of you probably will say, well, why business or psychology deal with this issue? We actually look at leading causes all the time. So now I'm actually looking at the leading causes in Australia. And most people probably can guess the heart disease will be number one. How many of you believe that intentional self-harm actually translates into the layman term is a suicide? Or die by suicide is number 10. Australia has been, in the last years, I believe, as a whole total population, the intentional self-harm is ranked number 14. And right now is number 15. However, the rank for males consistently stay at number 10. You might say, well, how that is related to today's topic? Let me give you a different perspective to look at epidemiological data. If I started to break down based upon age groups, 20, 24, 25, 34, and so on, you're actually going to see that among those groups, okay, basically they are the working groups, right? The working age groups. And the suicide is ranked number 3. So initially we think about heart disease number 1, right? The number 1 cause of a disease, a cause of a death is heart attack. Remember the earlier slide? But this one actually turned out to become number 3 for this group. For age group 25 to 34, rank number 2. Heart attack, cancer actually do not make it to number 1, number 2 for those age groups because they're younger. And so if you start to look at the data from 2005 to 2009, the pattern is pretty consistent. For the working age group, the suicide actually is ranked pretty high. It's number 3, number 2, and number 4 in that range. So is this a prevalent? Means, is this a hidden occupational fatalities? Well, let's think about how law defined occupational fatalities. Any kind of act, even in Australia, or in the United States, or in the UK, would define occupational fatalities based upon where the problems occur. About 75% of suicide occur in the house. They rarely kill themselves at work. Okay? So what happened to those individuals? Those data will never be able to move into our surveillance system. We actually miss those individuals. Unfortunately, there's no good surveillance system or data in Australia. Queensland is much better, but it's still very difficult to use. But there's no such data in the other states or provinces. There's no such data in the United States. I was lucky enough to have opportunity to actually look at the coroner reports to specifically classify them based upon their occupation when they killed themselves. And I was able to look at just these two populations, construction workers and agricultural workers. And this is the general population. That this 67.3 means they are 67.3 per 100,000 people. Okay? That's the terminology typically used in epidemiology. We use per 100,000 as a base, so that you have some kind of ideas. So if you look at overall population, general population in Colorado data is 67. Agriculture is 226. It's about, agriculture actually die by suicide almost 3 times higher than the general population. Now you might say, well, this is only happened in the US. Actually, no. It also happened in Australia. It just doesn't have a very good data to give you that specific estimate. But we already know from the literature that farmers, construction workers die by suicide more often than general population. Not just in the United States, not just in Australia, but also in Japan, in Europe. But those data usually will never be included as treated as occupational fatalities. So that's the point I'm trying to make, is law or acts is not a panacea. I try to use this as another contrast to give you an idea based upon the data in the previous slide. Over the past 3 years, work-related fatality, okay, that's occupational fatality, specific data. There are 37 agricultural workers, but there are 46 agricultural workers actually died by suicide at the same time, same period of time. 81 construction workers die at work because they might fall, they might get struck by object, but there are 360 construction workers die by suicide. Those individuals will not be included in our legal system. This group will, because, very simple, law was very specific, has to happen at work. And 75% of them actually happen outside. Now, let me stop here for the moment. We only look at those fatalities. Let me give you a different way to look at these hidden occupational fatalities. From our research, we pretty much estimate roughly between 11 to 25 attempts lead to 1 completion. So you translate this number back, so give you an idea how many attempts happened. Furthermore, I give you another example is how many survivors are affected by those individuals. We estimate on the average is about 6. Okay? So when we look at the victim, we look at those data, we have to look beyond the victims. We look at people who attempts. We look at the people who are affected. We call survivors. Now I move into economical context, the financial decisions. And the first slide actually is somewhat more positive results. But to give you an idea, this is a 5-year project. And so these researchers actually measure the job stress. Okay? They measure the job stress. And 5 years later, they track the healthcare cost. So if you look at those individuals when they do not have a high stress condition, which is low stress conditions, the healthcare cost actually is somewhat low, relatively, compared to individuals who experience high stress. Okay? But there's another catch. Particularly for this group not only experience high stress, they also experience low control about what they are doing at work. Look at the differences. Suddenly amplify the negative effects. Initially, you just look at demand itself, or stress. Even low stress, high stress, it's about the same in terms of healthcare cost. But if you provide employees with little control about what they are doing during their work, that is the healthcare cost. Now, this is the kind of data probably will encourage CFO to say, gosh, we have to do something, right? So let's start to think about how CFO think about questions, because I'm going to show you a study we did with a CFO. Traditionally, when CFO look at the data, they might say, well, we have some kind of financial problems because high healthcare costs. So the first thing CFO probably would do is trying to cut healthcare costs by increasing premiums or by minimize potential benefits. They really go back to look at the leading indicators. I can use the word called root causes, a simple way. The root causes actually will cause those financial indicators or financial burdens. And also those lagging indicator means injuries, the suffering. Those are the outcomes. And traditionally, when we look at the management system, we tend to manage it in this way rather than this way. I'm going to show you some data later on. So I basically translate that framework I explained earlier into the distal driver, proximal drivers actually do and the results. To give you an idea that I wanted to emphasize more on the leading indicators. And that's what I'm going to present in the subsequent slides. This is the study we just finished in the United States. We actually interview small establishment, medium, and large. Small means from 1 to 100 business establishment. And the median is from 100 to 499, and the large is above 500. Okay? So we basically ask a list of performance indicators, and this is one of the leading indicators. Just give you an idea. Managers and supervisors are accountable to safety and health roles and responsibilities. That actually fits very well in the Australian law because employers are responsible for it, right? Now, if we ask them how important it is, one means the most important. You're actually going to see they think it's very important. Is look at small, medium, large companies. They all believe it's important. But if you ask them how likely are they going to use it, actually small-sized companies say no. They will never use it. Okay? So that's actually there's no data here. They won't use it. For the medium, they say they might. For the large, it's about the same. Then we ask them specifically, are you using those indicators? The answer is no. Now, this is another study we did from the CFOs and the chief operating officers. And we asked them the indirect cost per dollar of direct cost in any kind of safety and health practices. About the 50% consider is about $2. That means 2 to 1. So if you have $1 for the direct cost, that means you probably will have about $2 in direct cost. Follow me so far? Okay. But this is actually the data from Australia, from the workers' compensation data. This is a direct cost. This is indirect cost. It's about 6 times. So all the CFOs or CEOs actually consider much, much less compared to the actual data. What does that imply? That implies how they're going to process in their management system. They will not invest too much, spend much time. This is also asking about the return of investment. If they spend $1, how much dollar do they think they can get return? Again, for almost 50% of the people consider it's about $2. Okay, so those kind of data actually, which tells us that if those managers, CFO, CEO, or operating officers believe that those are not really, doesn't really generate too much indirect cost in their process, strategic management process or practice, they actually will abandon this kind of thinking. They will not spend much time worrying about that. But in reality, in the previous slide I showed you, it's almost about 6 times. Probably in the occupational safety and health arena, I would say design and control probably is the most well-studied and most well-developed areas. And one of the topics right now is very popular. It's called prevention through design. Essentially, is when we design anything, we're trying to design all the potential dangers, hazards, risks out. And about 2 years ago, I have a project with John Deere. When I visited John Deere's, I talked to those engineers, and I realized that John Deere's actually asked all the engineers, they have to spend time working in the assembly line based upon their design, because that will force them to think about whether their design is appropriate. Okay, so this is a kind of concept. This is a traditional car carriers. A lot of fall accidents when they're trying to arrange cars because there's no fence. So this is a very simple, very easy way to design out, right? With design, we eliminate. Patients' lifts is also good examples. I work with nurses very often, and this is probably one of the most promising approach or application have been used in the hospital. So you might say, well, if we have those patient lifts, everyone will use it because that can reduce back pain. But in realities, that we do know if we provide a lot of patients lifts, we increase their use. But at the same time, those psychological costs actually will inhibit them to use it. What do I mean that? Psychological cost means very inconvenient. I mean, in the rush, I have to save patient. Or the hoist is stored somewhere. I have to go there to grab it. I just don't have a time. So when the workplace provides a way for them to use those hoists, and they actually are not motivated to use it because it's too far away, too unfriendly. This is another study we did in our team. And this is a typical kind of tool we use for sheet metal. The cutting, some of you probably work at home, you probably use these tools. This is the traditional tools, and we redesigned to here. We're basically trying to make sure that this tension, we reduce the tension so that people will not experience the pressure when people use all the time, right? But this is a traditional one. Why we create such a big one? Well, because the traditional users are bigger, they have a big palm. So it was designed for them. And this is the one actually will be applicable to everyone to use it. Now, we might guess this will be popular? Well, the answer is no. A lot of old-timers prefer to use this one for many, many strange reasons. The feeling is different. The color is not right. And they just don't feel they're cut quick enough. Okay? Again, we can talk about design. We can control, eliminate many possible hazards. But every time when people are in the system, it creates complexity. So I'm going to spend time, actually we'll focus more on these remaining sessions. I'm going to talk about how job, organization, family, and individuals could affect the various behaviors or the outcomes. This slide essentially tells us, based upon any kind of Occupational Safety and Health Act, we needed to have a certain policy, safety policy, and so on. So this study will actually do not look at the policy per se, because every participating organizations have the same policy, because they belong to the same insurer when I work for the insurance company. So I know they have all the insurance. They follow the same policy, otherwise they will not get discount. Then we actually started to ask them about the quality of executing policies. Then we started to see the differences. When employees believe or experience a positive quality, how they handle, actually will report fewer injury risk and the fewer injury incidents. And this is another studies we did. We look at how the safety climate or safety culture in this particular case is how much we encourage our employees to share the errors. That is called error management climate. It's part of a safety climate or safety culture. I use the word safety culture and climates interchangeably here. But climate is essentially just like a temperature, a snapshot of that environment. So that can tell you how strong or how weak their culture is related to, in this case, related to error management. And by looking at this data from two different studies, we all show that when the companies emphasize the safety communication, encourage sharing the errors, they all improve their safety behaviors and also reduce work-related pain. This one is a study we did. It's 5 different times. So we actually look at how much control individual has at work. Then we start to track the 5 different times how much they are attacked by patients. Those are nurses working in a geriatrics ward. Okay? So think about, they cannot, most of them really could not control much about how patient reacts to them, right? Generally, that's what we think about. So if you start to look at the low control condition and high control, let's just look at high control conditions. If nurses actually can do the things based upon what they decide, they are empowered to do it, they actually experience fewer aggression toward them. They actually are able to control. For the low control conditions, if you just look at this one, this is the group not only has a low control, but also has a low support. Those individuals actually are attacked by patients more than other groups. So far, I've been talking about organizational issue, talking about safety cultures. Essentially, is trying to say that we are looking the leading indicator aspects. And those are the potential root causes that we can improve or change. This is another studies. We look at the leadership. But this time I wanted to emphasize that there are 2 different types of leadership. What do I mean that? The one type of leadership is to provide visions and inspire individual to follow. That's what we call the transformational leadership. And the second type of leadership is a carrots and stick approach. That means the managers always pay attention to any mistakes and monitor the mistakes. Okay? That's called management by exception. You might say, well, this is a poor leadership. Not so. Because for any kind of good leaders, they pretty much possess both. And their relationship also is somewhat in moderate range. But they actually show a different kind of pattern when we talk about the work and family conflict. So this is let me start from here. We actually trying to understand how the leaders can improve or minimize, reduce the conflict between work and family. Okay? So if you start to look at this side, is the individual who do not work in the high stress condition, is low stress conditions. Generally, if the leaders is high transformation, okay, if it's a high transformation, they actually experience fewer conflict between work and family. That probably is not surprising. I mean, because good leaders support it. But interestingly, when leaders use the carrots and stick approach, okay, which is these sessions, the individual actually experience more conflict between work and family, particularly when they experience the high stress conditions. This is probably the one we talk about most often, because every time when I talk to the industries, they always tell me we need more trainings. And when I talk to the consultants, they always tell me training is the best business. So I'm going to spend time talking about training to make some points. Training is important, but the important part is how we can actually move from training to actual transfer. Actual transfer means that people actually applied what they learned in the training program in the real job setting. That's called transfer. So our whole purpose to conduct a training is not for the sake of having a training. It's really wanted to see how individuals to apply what they learn from the training program to the reality. That is called transfer. Let me give you some facts. Successful transfer of training range from 10% to 40%. That's empirical data. I can actually show you further pessimistic results. We pretty much have some ideas about a relationship. So let's say if something A object and B object has a strong relationship, that usually we can say that relationship close to 1. If there's no relationship, we're going to say that's close to 0. Okay? Just for the sake of argument. So this is the studies actually look at accumulated studies to come out with an average relationship. The average relationship between post-assessment and post-learning is about 0.07 to 0.21. What do I mean post-assessment? Post-assessment is to ask trainees, are you happy with the training programs? Are you satisfied? Does the trainer perform well? And the relationship between whether they like it or not and how much they learn, the relationship is between 0.07 to 0.21. Okay? How much they like the training and how much they actually going to transfer is about 0.02 to 0.26. Again, it's all in a very, very small range in terms of relationship. If people learn how much they actually is going to transfer, the relationship is 0.08 to 0.18. So roughly, pretty much all the data showed us that if people are happy, it doesn't necessarily infer they learn. If people learn after the training program, it's not necessarily that those individuals is willing or are willing to apply those skills they learned at work. So considering how much money we actually spend in training industries, and it's important for us to actually find out why people don't want to transfer, right? So one of the studies we did a training program for suicide prevention, and we actually asked those high school students, our subjects actually are high school students. We asked them, if I felt depressed or suicidal, tell me the reason why I would not seek out help. Because that's the best way to tell us what are the barriers we are facing. Right? We just give them the training. And we wanted to know exactly why they don't want to use it. 54% of students say they don't know what to say to their parents. And when we look at the data, I start to ask all my team, my graduate students, and everyone say, you know, that's really true because we never were taught to have a conversation with our parents when we feel depressed. We are not really trained to talk. I mean, if you look at this as the 5 things, that's probably it gives us an idea that even we can conduct the best training programs, probably 50% of the kids may not use it for these simple reasons. And therefore, we have to really redesign our training program to address those issues. Now, so far we have used different examples. So we're going to say why people don't really want to change. If we know it's good, why don't we change? Well, typically, undesired or previous behavior have some nice features. Rewards are immediate. Less efforts, more comfort. Because we use it all the time. We don't have to relearn. But for the desired behaviors, there's a price to pay. Requires a lot of efforts, very discomfort. I mean, particularly when you wear that protection equipment, working in the trench, it's very uncomfortable. And even you do it right, you will not get reward, right? So the challenge for us actually is called the principle of least efforts. That means for any desired new behavior, they tend to be pricier. It's more difficult to change because psychologically it requires more efforts, has less rewards. That's the reason why, one of the reasons why it's hard to change. So one of the studies we did is a 6-month studies. We look at how we can actually counter those costs. And the approach we use is the target is a journeyman, right? But we don't really train journeymen at all. We actually train their supervisors. But we know at the same time supervisors will not necessarily follow unless their top management follows through a monitor. So these training programs actually consist of 3 components. The first component we call the driving force, that the superintendents actually monitor those supervisors' behaviors after they receive the training. They actually monitor whether they actually performing those behaviors, engaging those behaviors. And the foreman actually receive only 3 hours of trainings. But foreman trying to learn how to be a role model, how to talk about, how to provide good feedback to their journeyman if a journeyman makes some mistakes. How to provide recognitions. It's that simple. And the result is, after 6 months, if you look at the injury, this is the different control group in a sense. It's about the same. But after 6 months, for the treatment group, those group who receive training, the injury rate of report is 0.78 versus 2.48 within 6 months. Again, we did not train journeymen. We did not. We only train foremen. And that just gives us an idea that as long as we can find the tipping points, so we can try to change, we can change the sign of this, the sign of this equation. That is to identify a tipping point, identify a changing agent, and foreman in this case, or supervisor, is our changing agent. So what's the take-home message? I don't have many, but I would like to share very few slides so that we all can take away, I hope. And the first one is we have to look beyond absence. Traditionally, when we look at health, workplace, we look at the dark side. We rarely ask a question about how can we make people happier? How can we make people increase aspiration? How can we increase calling? This is the one pretty much missing in the health, safety and health arena. Second take-home message is we always manage what are measured. If we all focus on lagging indicators, we all focus on financial indicators, that's how we will manage. So if I look at economic loss, I'm going to cut, because from the financial perspective, this is the most intuitive way to cut cost. But if we actually started to measure leading indicators, we actually will be able, ahead of time, to address this issue before they occur. Unfortunately, most of the organizations never include mental health, well-being, aspiration, satisfaction as the performance indicators. And most organizations probably will consider performance indicator is what's your sales volume, how many productivity, how many pieces you produce. But if we start to look at every countries, they all use health indicators, at least health indicators, to show how healthy a country is. So if countries are doing this, why organizations don't do it? This one is, we all love to use some best practices, such as certain training programs, we jump in. Certain new reward system, we jump in. My point here is sustainable change requires more than implementing best practice, because there are a lot of external factors and distal drivers that will affect how people do things. Again, still go back to the question, we need to know the root causes rather than just emphasize the results. The last slide, so two things I want to share with you. The one is really coming from Robbins. In Robbins' report, he actually laments everyone. I use the word everyone. He used the word apathy. He said the reason why we have so many injuries, so many problems, because of apathy. And he also firmly believed that any kind of law is not a panacea. We have to rely on self-regulation. So what does that mean? So I started to realize that Kant in 1785 actually already addressed the issue about apathy. Let me try to read this and try to reinterpret this. Act in such a way that you always treat humanity, whether in your own person or in the person of any other, never simply as a means, but always at the same time as an end. What does that mean? means that the reason we become apathy because we are not involved with those tragedies. Those are just the numbers. That's what Kant talked about. That is the mean we think about. We never really think about that's part of us. It's the end. At the end, I'd like to share this story. When I gave a talk at Griffith University a couple months ago, and incidentally I met this CEO, and he also received the flyers, just like a university, send the flyers, and he shows up. And after I finished the presentation, we spent another 2 hours chatting, and I had a wonderful time with this individual. And Jorgen, he is the CEO specialized in mental health in constructions. So I said, Jorgen, why did you change from construction trades? Because he's a construction trade. He was a superintendent. He changed his profession, so to speak, and trying to work on the mental health issue in constructions. And Jorgen gave me his personal story I'd like to share with you. He said one time one of his crew members died at work. All his team gathered together the money. They have a bucket and collect all the money for everyone on site. And he brought that bucket of money and went to the widows, to see the widows. And the widows refused to accept the money, and she actually asked Jorgen, and this is the question she asked. My husband spent almost every hour with you, almost every day. Why you folks did not take care of him? So at the end, when I talk about healthy workplace, it's all our responsibilities. It's not just the mean, it's really the ends. And that's all we are. We will all be affected. Thank you.